Hi guys, so today we will be answering the question, why do I get heel pain with running? It's a really common problem, and the most common cause is something called plantar fasciitis. It's so common you may have heard of it before. Plantar fasciitis has an incidence rate in runners of about 5 to 10%. It's one of the top 3 running injuries, so it is really common. In fact, if you go to a running club with about 20 members, 1 or 2 of them will get it within the next 12 months. The severity can range from hardly restricted at all and can keep running to actually can't run whatsoever because the heel pain is so bad. How do we know that our heel pain is plantar fasciitis? The 3 things to look for is the pain is localized, meaning it's a very small area and it's localized to the heel, the sole of the heel, not the back. And it's painful when you press on it. It's what we call tender-on palpation in that spot right there. The other thing to look for, a key factor, is that if it's more painful with the first few steps out of bed in the morning, if you've got those 3 things, localized pain in the sole of the heel, tender when you press on it, and painful with the first few steps out of bed in the morning, there's a very good chance it's plantar fasciitis. And if it's worse the day after, like long runs or intense runs, it's even more likely to be the problem. If you do have any pins and needles, tingling, numbness, or anything in the foot, it could be other things. They will need to be checked by a health professional. So, what exactly are we talking about here? The plantar fascia is a band of connective tissue that runs along the sole of the foot, and its main job is to help support the arch of the foot. Where it starts, where it originates from the heel bone, that's the part that becomes painful. It's actually called plantar fasciitis, but itis means inflammation, and it's not actually an inflamed problem. It's more of a degenerative type of problem where you get damage to the plantar fascia in that area. You may hear it called plantar fasciopathy now, meaning plantar fascia pathology, or even sometimes plantar heel pain, because it's not specific to do with inflammation. The follow-up question is usually, why did I get plantar fasciitis or plantar fasciopathy? There are certain risk factors that predispose you to developing this problem. And because there's quite a few, we're going to dig into those in the next video. So we'll be going through the risk factors, what they are, and how you may be able to mitigate that risk a little bit by changing your training habits. For today, just to summarize, the most common cause of heel pain in runners is plantar fasciitis / plantar fasciopathy. The way to tell if that's what's going on, it's painful on the sole of the heel, it's painful when you push on it, and it's usually more painful first thing in the morning.